Hi, it's Dr. Ahmed Erkat, Dr. Cat for short, and this is the case of the week answered. Amongst the labs we did was a urine toxicology screen, which tests for marijuana, cocaine, amphetamines, benzodiazepines, opiates, and alcohol. The urine tox on this kid came back positive for THC or marijuana. We went back in and talked to the parents about the results, and they did tell us they do have some gummies they use for sleep at home, but that those gummies were locked up. And the gummies had a certain color to them, and the child did not have any of that color on their teeth or tongue. But thankfully, in this case, it was the only reasonable explanation. Pediatric emergency department visits for tetrahydrocannabinol or THC ingestion has increased dramatically in recent years, particularly following cannabis legalization and the introduction of edible products. The increases are most pronounced in young children under 6 years of age, with unintentional ingestions accounting for the vast majority of cases in the United States. Pediatric exposures to edible products increased by 1,375% from 2017 to 2021, rising from 207 reported cases in 2017 to 3,054 cases in 2021. Children under 6 years old represent the highest risk group for unintentional cannabis ingestions, with the mean affected age of affected children ranging from 2.9 to 3.8 years across studies. The severity of cannabis exposure has increased alongside their frequency. Among reported cases in the United States, 22.7% of patients were admitted to the hospital, with 14% requiring critical care admission. A dose-response relationship has been established with THC ingestions of greater or equal to 1.7 milligrams per kilogram, predicting severe toxicity with a 97% sensitivity in children under 6. Severe toxicity includes cardiovascular, respiratory, and neurological effects, requiring intensive interventions. Edible cannabis products, particularly gummies, account for the majority of pediatric exposures. Nearly half of all pediatric edible-related events involved gummy products, and 83.5% of exposure across all ages involved edible products. Most exposures, up to 97%, occurred in residential settings like the home, with 88% attributed to inadvertent ingestion due to access or lack of safe storage. The American College of Medical Toxicology recommends several packaging and labeling measures, and they include 1. Child-resistant packaging, consistent with the Poison Prevention Packaging Act. 2. Unit dose or blister packaging for multi-dose products. 3. The prohibition of labeling and advertising which appeals to children. 4. Clear warning labels with hazard pictograms. 5. The required listing of THC concentration, total content, serving size, and THC per serving. And 6. The inclusion of the Poison Center phone number 1-800-222-1222 and 911 on packaging. The hardest thing about this case was that there was no way for us to know how much the child had taken, and so it was difficult to estimate how long it would take for him to recover. Since his vital signs were normal and he did start waking up to parts of his physical exam, along with the toxicology team, we kept him on cardiorespiratory monitoring until he woke up and started acting himself. If you have kids or you've ever been around kids, you know that young children and especially toddlers will get into any and everything they can, especially if it looks like candy. Almost every time I'm on call, there's at least one child who comes to the ER for some kind of toxic ingestion, be it marijuana or more dangerous medications like blood pressure medications and heart medications that belong to a parent or grandparent. It's important to do our best in keeping the medications secure in child-proof bottles and to keep these medications in places where a child can't reach them. If you enjoyed this, make sure to follow, like, and share. See you next time.